Good morning. My name is Dr. Susan Wolver, and I'm a general internist practicing primary care and obesity medicine at Virginia Commonwealth University in Richmond, speaking on my own behalf. Thank you for allowing me the opportunity to speak, and thank you for your commitment to improving the health of our nation. I am here to implore you to consider the mounting evidence in support of a low-carbohydrate diet as a viable and necessary approach in the new Dietary Guidelines. I've been practicing medicine for 30 years. The first 24 were a cycle of seeing patients with their uncontrolled chronic conditions, tweaking medications while watching them gain weight and their diseases worsen. That was in spite of my continually recommending exercise and a diet of whole grains, fruits, vegetables, lean meats, and low-fat dairy. But it never worked, and I mean never. In those 24 years, 2 people lost weight and 1 gained it back. And then, when I got to be middle-aged and that same advice no longer worked for me, I realized that my advice might be wrong. I tried a low-carb ketogenic diet, lost weight effortlessly, and tried it with my patients who were desperate for help. Patients like a young woman with newly diagnosed out-of-control diabetes. She ate perfectly according to the guidelines, and standard advice would have been to eat less, move more, and start insulin. She would have been relegated to a lifetime of needles, weight gain, and the psychological impact of living with a chronic disease. Instead, I taught her a low-carb diet, and in just 3 months, she was barely in the pre-diabetic range, lost 25 pounds, and was overjoyed. More than 90% of the patients who come to me on insulin are able to discontinue it. In April, the American Diabetes Association said, and I quote, "Reducing overall carbohydrate intake for individuals with diabetes has demonstrated the most evidence for improving glycemia." But a low-carb diet is beneficial not just for patients with established disease. A recent study by the University of North Carolina showed that a full 88% of the nation has at least one of the 5 components of the metabolic syndrome. Results from my patients and studies like the A to Z trial prove that a low-carbohydrate diet not only has better weight loss than standard dietary advice, but better improvement in every component of the metabolic syndrome. Nearly 1,500 people have come through my weight loss clinic over the past 6 years with an average weight loss of 12% at 9 months and have kept it off for at least 18 months, with a reduction in medication burden, improvement in blood pressure, fatty liver disease, sleep apnea, arthritis, and enhancement in quality of life. I was so burned out from doing the same thing over and over and not getting results. I am now excited about practicing medicine again, knowing I can help my patients improve their health. But we are tired of having to defend a low-carbohydrate diet as a valid dietary choice. It is working for us, is supported by irrefutable medical evidence, and demands a place in the guidelines. Thank you.
Be sure to hit that subscribe button for more highlights and information about the changing dietary guidelines in 2020 and exclusive analysis you won't find anywhere else on YouTube. And make sure to hit that notification bell too so you don't miss the next video. Y'all know what time it is. Red Pill Vegan. Next.